thank you all very much for coming here. I realize that all of us have things that we like to do on Saturday and Sunday, and so all of you have given some of your life, some of your time to come here, and I commend you. And everyone in this room is equally as important as everyone or anyone else. Doug Wickham's talk is full of information that's very, very important, and how to put this together so that when we're done with this conference, you have something that you can go home with and that you can become more active in these areas. It's very, very important. My little discussion, I'm blessed to have 2 sessions with you. They will be continuous from one to another, but I want to try to get across some ideas and some thoughts about life and death, about relationships between God and each of us and us with God, some concepts about persons, a unity of the body and the soul, spiritual and physical, how we're united while we're on earth. To do this, I'll present some historical facts and try to put together some of the things that Doug Wickham talked about with things that I'm going to be talking about. And I'll tell you about Joseph, who's the baby that started my study of this part of medicine that has to do with brain death and organ transplants. I'll tell you about Jahai. You can see that this wristband that I wear, it says Jahai is alive, is what it says. And on the other side, it says prayers work. And her mother gave me this when I visited her a couple of months ago in New Jersey. And her mother said, "That's what you told me, prayer works." And so she made this, and she gives them out. She gave one to me. And you'll see a picture of Jahai's hand and my hand. And in the past, they showed pictures of Jahai's hand and hands. And some people said, "Well, how do we know it's Jahai?" So I had a picture of my hand and Jahai's hand joined, and then how do you know it's Jahai? Well, how do you know it's my hand? So you'll see that. The cards for the questions are very important. You'll have questions as we go along, and write your question down so you remember to ask them. There'll be time. And believe me, we'll deal with as many of them as we can while we're here. But I don't plan to leave this area until every bit of questions and answers that each and every one of us might have, that we deal with those. I have to ask you to have an open mind, to open your mind, because you have been brainwashed. The society has been brainwashed. You've been brainwashed by lots of words, but words like brain death. Brain death is brainwashing. And the way that you brainwash somebody, and anybody that's ever been in service, I have not myself. I had a little bit of ROTC, but the boot camp is the brainwashing. Anybody that's ever been in the service knows that, and they have a technique. One of the things that you can do with brainwashing is use words like brain death. And you know what brain is, and you know what death is, and you hear brain death and you think of death. Brain death has nothing to do with death. Brain death is life. Brain death and life, they relate to each other like life insurance. Life insurance has nothing to do with life. It has to do with death. But you hear life insurance and you're probably willing to think about it. If you heard death insurance, I don't want anything to do with that. When you hear brain death and I tell you it's life, you say, well, I never thought about that. I thought it was death. No, brain death is life. Everybody who's called brain dead is alive. Everybody who's called brain dead is alive. So it's brainwashing. So part of why I say it like that is because in order for us to even communicate with each other, you have to clear your mind of the nonsense that you've been fed. And I don't mean put down when I say nonsense, but we're fed all the time with nonsense. Where are we not fed nonsense? The Mass this morning. The Mass, the sacraments, that's not nonsense. That's truth. And so we have to get to the truth, and then we can go forward from there. The relationship between God and each one of us is special. Every human being is different from another. Each one of us is unique and unrepeatable. We're talking about things that have to do with end of life. Life issues go across the board, and yes, things are moving fast in terms of death and having death imposed on it. Moving fast in our society, and sometimes people will say, you know, like I don't even know if I have all of my Christmas decorations taken down from last year, and Christmas is coming up again. And somebody says, well, time passes so fast. No, time passes just always like it did. But what happens is we cram more and more stuff in between, and don't leave so much time to digest things, to think about things, that kind of things. This culture of death, which I call a system of death. It's a system of death. And yes, it's imposed on us now, but you have to think in terms of life and what happens across the board. And contraception, Father Hardin called contraception the gravest moral evil in our time, the gravest moral evil in our time. And contraception's not news. Serranos described 17 methods of contraception, and he lived between 98 and 138 AD. Comstock was a member of the YMCA and was passed laws against obscene matter, and then laws against the distribution of contraceptive. And then there's but the Comstock law was enforced against Margaret Sanger to stop her, and then the Lambeth Conference warned against the unnatural means of aborting conception in 1920, and by 1930 it took the opposite position. The Lambeth Conference had the acceptance of artificial birth control, and that's one of the major roots of the system of death is the Lambeth Conference and artificial birth control. And artificial birth control has to do with contraception and sterilization. These are evils that the Catholic Church has had clear teachings about this, and has given direction. Pius XI, the encyclical on Christian marriage in 1930. Doug mentioned that 1938, the Euthanasia Society of America, 1946, a committee legalizing voluntary euthanasia in New York. 1958, the Anglican Conference, the number of children's on the consciences of the parents. So it's taken away God and put it to parents in terms of how many children, and taken God out of it. The Euthanasia Society expands more. Cecily Saunders, specialized care for the dying. The word dying, the word dying means that you're alive. Someone who's dying is alive. They're not dead. So you have to be careful. It's It's not new. St. Augustine taught that there is no Latin word for dying. There's no Latin word for dying. It taught very clearly a person is either alive or dead. So you can't be both. You're either alive or you're dead. You can't be pregnant and not pregnant. You can't be both. There are things that you can't be both. Then how do you put these things together in terms of contraception, euthanasia, and then organ transplantation gets involved. In 1967 was the first heart transplant, and some of us that are a little bit older remember Christian Bernard, the first heart transplant, and much notoriety. How about the second heart transplant? The first one was in South Africa. How about the second one? It was in Brooklyn, New York. Brooklyn, New York. What did they do? They cut the beating heart out of a 3-day-old baby who had a problem with his brain, and gave his heart to an 18-year-old baby who didn't have a problem with their brain but needed a heart. And so one life versus the other. Remember Bishop Brasida's talk, good and evil, and one good trying to save the life, the evil killing. And they did it. They killed the baby, cut the beating heart out of the baby because he had a problem with his brain, and gave it to an 18-year-old baby. At the end of that time, both babies were dead. They killed 2 of them. Yeah, December the 3rd, 1967, killed 2 babies in Brooklyn, New York. And out of that became the stimulus to invent brain death, so that they could call somebody brain dead and then pretend like they were dead, and then they could cut their beating hearts out and they wouldn't be killing them. The living will is part of all this. There's nothing living about living wills. Living wills have to do with death. Living wills are documents that are put together to protect doctors and hospitals against liability. No one should have a living will. Living wills set it up so that you say under certain conditions that you want to be dead, you want to be killed. And then even if something else happens, no one can do anything after you're dead because you've already documented that you were okay with becoming dead under certain conditions. And so I've been saying these things for a long time. Living wills violate 2 basic principles of medicine. One basic principle of medicine is that you get all the information before you make a decision. Another basic principle of medicine is you use current, up-to-date information. Well, if you're going to say something about what you want 5 years from now, you can't have all the information, and you don't know what the state of medicine is. So all living wills violate 2 basic principles of medicine. No one should have a living will. Hospice got introduced in New England, St. Christopher's Hospice, and there's an article recently from a nurse in St. Christopher's Hospital that I read and sent to some of you. 68, the first brain death law, and the Harvard Committee published in the JAMA, in the Journal of the American Medical Association. Dr. Walter Sackett, the first living will law that was in Florida was in 68. Kubler-Ross, 69, the stages of grief. The Hastings Center, Daniel Callahan, you heard Doug mention Daniel Callahan, Willard Galen. These people are active in propagating brain death, organ transplantation, living wills, imposed death. The first brain death law was in Kansas, and 72. Look at these laws for just a little bit. Cessation of total brain functions, and then ordinary standards of medical practices is what the language was. And in a little bit, in a minute, you'll see differences. Instead of ordinary standards, persistent vegetative state was introduced in 72. Persistent vegetative state is another thing that's just made up. It's just made up. Brain death was just made up. Persistent vegetative state, they it's somebody who's in this persistent vegetative state is very much clinically like somebody who's brain dead. In Teresiago, they had these things all jumbled up. The only difference is that somebody that they call brain dead is on a ventilator. Persistent vegetative state acts pretty much the same, but not on a ventilator. But brain death was invented mainly to give organs and to kill people if their quality of life was less than desired. Vegetative state was made up for a similar way, but in kind of a prediction, well, they're going to be dead within 6 months or something like that. But it's just a made-up thing. They changed the names, as Doug pointed out, changed the name. The Euthanasia Society became the Society for the Right to Die. Palliative care is substituted for hospice. And then 75, the American Bar Association, remember I told you about functions a minute ago? They said cessation of total brain function. And of course I write to them and I say, well, any absence of any function is a cessation of total brain function. But do you think they don't know what they're doing? They know exactly what they're doing. And then they use usual and customary standards, and I'll show you more about that. And then the Kiernan Quinlan case. The Kiernan Quinlan case is the index case for the Right to Die movement. Kiernan Quinlan, when they first started with her, they said that she was brain dead. And then as they went on, they said, no, she's not brain dead. Kiernan Quinlan was a college student who overdosed on alcohol and drugs and then was found unconscious. And so they said, well, if she's not brain dead, we still want to be able to turn off her ventilator. And they did this on the basis that she had this very destroyed brain. And all the doctors who testified said that if they stopped the ventilator, she couldn't possibly live another year. Well, they eventually did stop the ventilator, and she lived 10 years. She lived 10 years. And then when she died, it took them 3 years until they examined her brain. This is the index case for the Right to Die movement. It took them 3 years. And then it took another 6 years until they published the results of her autopsy. And you know, there's a big brain, and she's supposed to have absence of all those functions of her brain. Her main pathology was right in the center of her brain, in her thalamus, and the cortex was normal. Her brain was normal at autopsy. That's the index case for the Right to Die movement. And who writes about those things? I do. And that kind of thing. And so then the Uniform Brain Death Act, see, the American Bar Association definition of death, so then we quibble about that, quarrel, tell them single function you can't do, so then they changed it to cessation of all functioning of the brain. And see the words functioning, function, functions, and then they also made it in accord with reasonable standards. And these words have meaning. For instance, death means something. And you know what death is. Everybody knows what death is. How we don't know because by experiencing death, but we know what death is from when we played with the caterpillar when we were a kid. When we had fish swimming around, and then wake up some morning and the fish is on its side and there's a little gill movement. But let me tell you, if you as a child and the gill was moving like that, you might say, Mom, something's wrong with the fish. And if Mom says, I'm going to flush it down the toilet, the kid would say, what are you talking about? My fish isn't dead, because the gill was still moving. But yet there came a time when the fish was dead, and you knew that. And if you didn't believe it right away, stick around, it'll stink. And that's what death is. You know, there's a difference between life and death. So when somebody is dead, their brain is destroyed, and has not only lost one function, but it's lost all of its functions, and all of the functioning is gone. But here's what happens. They observe the absence of functioning. That's all they observe. And then they conclude that the function or the functions are gone when they don't even know that the brain is destroyed, much less that the person is dead. Now, this is how the language is used, and you and I, as ordinary folks, we're not used to making ourselves so disciplined in terms of use of language. And we talk to each other and we understand, and we're not so disciplined. So when I started to study this, I had to first learn the language. And then once I learned the language, and I had to learn the language so I'd know what they were doing. And I found some articles in one paragraph. They would use functioning and function and functions and destruction and death all in the same paragraph, all interchangeably, like they're all different. Then there was a thing called the President's Commission. The President's Commission had nothing to do with the President, except President Carter appointed them. And then the President's Commission had to come up with this a new thing called the eventually became the Uniform Determination of Death Act. And then you remember I told you about usual and customary standards, and then I told you about reasonable standards. Well, they changed it to accepted standards. And accepted medical standards, the first time that I saw accepted medical standards used in the legal literature was in the Karen Ann Quinlan case, and then it's there with brain death. And there, look at there's Alexander Capron and Joanne Lynn. Alexander Capron, that Doug mentioned about Joanne Lynn, is so active in terms of palliative care and imposed death that's coming on at the end of life. They were the same ones that did brain death. They're all the same people. And it's just that they work on something for a while and then they switch over to a different name or something like that. But they're all doing things to impose death on us. And then the President's Commission was still there and came up with another booklet deciding to forego life-sustaining treatment. Again, Alexander Capron and Joanne Lynn. And then an article, Physicians' Responsibility Towards Hopelessly Ill Patients, doing in Journal of Medicine. Well, we didn't just idly sit by. We published an article, Physicians' Responsibility Towards Sacred Human Life. And ours is in Linacre Quarterly. Why is it in Linacre Quarterly? It's a medical journal for the Catholic Medical Association, but why is ours there? Because the New England Journal of Medicine wouldn't publish our article. Neither would the Journal of the American Medical Association. You can't get things published in those places. And I get it published in Linacre Quarterly, but they won't publish my things anymore either. But that's another whole story. Okay, now there's Joseph. Joseph was born in 1975, and you see a picture of Joseph. He's a tiny little baby. This is where the ventilator is attached to Joseph. Joseph's mother insists that he was 18 weeks. And I've had repeated conversation, one maybe more recently, about 4 or 5 years ago, and she said, I said, Janet, now let's go over again about that gestational age. And she said, yes, and you did everything you could to get me to say that it was more than 20 weeks. And she said, it could not have been more than 20 weeks. Now, why did Joseph make it? You see, you hear limitations about, they call it viability. That's a nonsensical word. You know, viability is capable of life. They're all alive. You know, but they twist the words, viability in terms of living outside the uterus. But anyway, you hear about weeks of gestation. When I started to do neonatology, they said 28 weeks was viability. Well, they got it down now, and they got it down to 23 weeks. And I read recently 22 weeks. Now here's Joseph, that's 20 weeks. Now, why does Joseph make it? Because they're saying they can't make it, but he did make it. Well, I'll tell you a little thing that you might not fully understand, but I'll tell you about it. how young can a baby survive has to do with not only his gestation and not only with his weight, but here's what. Janet was as tall as me. I'm 6'3". Janet was 6'3". When we talked eyeball to eyeball. Janet's husband was 6'7". Okay, now why did Joseph survive? Because here's why. When we put in an endotracheal tube, the smallest tube I can put in is 2.5 millimeters and be successful. Can I put in a 2 millimeter tube? Yes, and I have. And it does help babies to live. But what's wrong? What's wrong is that the 2.5 millimeter tube, we can still put a smaller tube down through it to suction it out. We go to 2 millimeters, we can't get a tube in it. You can't make a tube small enough to suction. So the limitation has to do with the size of the trachea. So why did Joseph survive? Because his trachea was bigger. Then that let us put a 2.5 millimeter tube in him. So anyway, Joseph was on a ventilator and was on a ventilator for about 5 weeks, and we'd see Joseph and he wouldn't move and he wouldn't breathe, and one of the fellows that I was teaching said, well, let's do an EEG. So we did an EEG, and it was flat. And what's written on Joseph's chart, it says consistent with cerebral death. So I looked at his chart and said death. I looked at Joseph. Joseph wasn't dead. So I called the neurologist. I say, Harvey, what's this all about? He said, just get another one. I said, well, he said, wait a good length of time, like tomorrow. I said, well, I'll wait a couple days. Unchanged from the previous one, it comes back. So I say, what do I do now? And he said, well, at some places they turn off the ventilator. I said, well, I don't do that. I said, I treat little babies, some live, some die. And there's Joseph when he's 7. We kept treating him. He did get off the ventilator. Joseph went to school. He got straight A's eventually, ran track, played baseball. And there's Joseph, he's married with 2 of his children. He has another child since then. So he worked as a paramedic for a while. But he's a fine young man, but it was Joseph who started my study of brain death. And there's Jahai, and believe me, that's Jahai's hand, and that's my hand, and you can tell. Now, Jahai, as Mary Ann said, was first of all, Jahai got an operation on the Feast of the Immaculate Conception in 2013. On 2012, the Feast of Our Lady of Guadalupe, she was not only declared brain dead, but she had a death certificate issued on her, and they wanted Jahai's organs, and her mother said, no, you can't have her organs. And so then it's a standard procedure. The thing that happens is if you get unconscious and you're young, especially if you're between 16 and 40, that's young. Jahai was 12, but if they're young, they want the organs. That's what they want. And if they can't get the organs, then stop treating. And so they said they were going to turn off the ventilator, and that's when Jahai's mother said, no, my Jahai's alive. And so anyway, her mother got on TV and was pleading for somebody to help her. So I called the airlines and got a plane ticket for the next day and went to Oakland to see her, but they wouldn't let any doctors see her. So I arrived there. It was nighttime. I rented a car. It was raining, and I ended up at the Candlestick Park, and that was the wrong place. And I had to find my way out of that and get back to the airport and go again, trying to get to the hospital. So I got to the hospital at nighttime, and it turned out to be a blessing because to be there then, because they wouldn't let any doctors in to see her. So her stepfather, Marvin, came down, and he was coming out of the hospital, and I was going in. The security guard was there, and he said, "Oh, Pastor, come on in here." And so I went in. So that's how I got in. And then from then on, I would go to see her at nighttime, and as a pastor. They treated Jahai as a dead body. They called her a dead body. They wouldn't even call her by name. When we did get her out of the hospital in the middle of the night, they wouldn't even allow a sheet from the hospital to go with her. It was an awful, awful thing. But Jahai got out of Oakland, California, and it's truly miraculous that how Jahai got to New Jersey. And New Jersey is the only state that has a conscience clause law. New York has one too, but it's not in the statute. It's in New Jersey, but it's in the statute. And that said if the relatives don't believe in brain death, they don't have to accept it. Then she got to New Jersey, not because of me. Let me tell you, I worked so hard to get a doctor to treat Jahai in California. No doctor would treat her in California. I called all over the country. No place would take her. And then some other doctors that I'm having to do with called a hospital in New Jersey and got the hospital administrator. We're a Catholic hospital in New Jersey. And the hospital administrator said yes. And then Jahai got flown there in the middle of the night. It was cold, freezing. And when she landed in New Jersey, thank God the plane made the landing in the middle of the snowstorm. And I got her to the hospital, and they did a tracheostomy and gastrostomy because they agreed to do that. But then after that, they were not happy because they had this patient who was brain dead in their hospital, and the doctors were not happy. She was there for 9 months. They never did one test for how her brain functioned. They refused to do any test. They would not do an EEG. They would not do a CAT scan. They would not do an MRI. Would not do anything. Gave her nutrition and kept her alive, thank God. It was 9 months, and then Jahai is now out in her own home, and her care treatment is much, much better. And as soon as she got away from there and get into her own home, her treatment is better. And she does have a healing brain. She has a serious problem with her brain, but she does respond. And I'll tell you some more about the brain as we go on. Temptation of Eden. Once again, we find ourselves before the temptation of Eden to become like God, who knows good and evil. God alone has the power over life and death. It is I who bring both death and life. But he only exercises this power in accordance with wisdom and love. Doctors want to be like God. They want people, and we're blessed. And doctors are special people. We have the privilege of taking care of. But we are never like God. The healing comes from God, and so heart transplant had to do with that kind of thing. Pope John Paul II, and this is very, very important in all of us, taking into account these distinctions and pay attention to that, taking into account these distinctions with the magisterium of my predecessors and in communion with the bishops of the Catholic Church, I confirm that euthanasia is a grave violation of the law of God, since it is the deliberate and morally unacceptable killing of a human person. That's in Evangelium Vitae. And then canon law has had some additions to it, and they make specific reference there to this teaching of Pope John Paul II. In Bishop Cressida's presentation last night, some of you that saw it, and I encourage you, if you didn't see it, to watch it. You can see it and watch it again. But he refers to that, and the Second Vatican Council, in discussing the respect due to the human person, gives a number of examples of such act, and the quotation is, "What is hostile to life itself, such as any kind of homicide, genocide, abortion, euthanasia, and voluntary suicide, whatever violates the integrity of the human person, such as," listen to this, "mutilation, physical and mental torture, and attempts to coerce the spirit, whatever is offensive to human dignity, such as subhuman living conditions, arbitrary imprisonment, deportation, slavery, prostitution, and trafficking in women and children. So the teachings of the church are clear about these things. It's just a matter, and the magisterium is clear. And you know, sometimes they'll say, I tell people, I work for Jesus and Mary and St. Peter and his successors. And you see, there are many people that claim to be Catholic, and many people that wear Roman collars, and even have more than just black suits. And you know, I'm not against any of the bishops. I never say anything against the bishops. I'm all for the teachings of the Catholic Church, but you have to understand the teachings of the Catholic Church. I'm a Catholic. I don't claim to speak for the Catholic Church. But the teachings of the Catholic Church can't change. It's impossible. If they change, it won't be the Catholic Church. Now, the human person is unique and unrepeatable, and each person is spiritual and physical. And the person on earth is a unity. There's one. Unity is a very important word. Unity. There's one. Each one of us is one. Unity of the body and the soul. They can't separate. They can't separate on earth. Death is a separation. There's no longer unity of the body and soul. And you can't have them together and separate. And it's so simple. Life is there. There's a unity of the body and the soul. And Boethius defined the person as individual substance of a nature rational. Individual has to do with our existence. God exists, we exist. God created us to show his goodness and to get saints, and each one of us is one. We're made in the image and the likeness of God. The image has to do with our substance. Our substance is just not sodium and potassium and chloride and ions, that kind of thing. It's not just a physical substance. The substance of the person is a spiritual substance. And likeness to God, we're supposed to, that's our nature, we're supposed to act like God. A lot of times we don't. I'm always happy that I don't slam the door too often. And of course, we have to be careful how we put the skillet back on the stove, that kind of thing. But we do things sometimes we're not always acting godlike, but we're supposed to. And then we're rational beings. But we're rational beings and we have an intellect. The intellect is a power of the soul, and that's to search for the truth. We can search for the truth and then use our will, another power of the soul, and we have these as persons, intellect and will. And intellect is not the brain. The intellect is a power of the soul to search for the truth, find the truth, and feed on the truth. The will is a power of the soul, which is to do good and feed on the good. And as human beings, we can do this. And then we have our conscience. Our conscience is not simply how we feel about something. You know, our conscience has to do with the teaching, how we form our conscience with the teachings of the church, with things that have to do with natural law, what's built into us, but they're all put together. That's where our conscience is, and that's where the right to privacy is. Privacy is based on that. And then where does it fit in terms of the law? God creates us, and with our creation, we have inalienable rights. The Declaration of Independence identified the inalienable rights, inalienable gifts to what? Life, liberty, and the pursuit of happiness. Liberty is different from freedom. Liberty comes from two Latin words that you put together. Liber, which means desires, and then the other part comes from arbitrium, which is like arbitrary, but it's mastery is the way to translate it. Then Latin reverses it. So it's mastery over desires. That's what liberty is. It's mastery over desires, and what's that? It's to do good and avoid evil, which is different from freedom. Freedom comes from man. Liberty comes from God. Freedom comes from man. that when the president goes out of office, he can give freedom to a prisoner. The king can give freedom to a prisoner. When we rent an apartment, we have the freedom to live there, to eat there, to sleep there, to have our friends in, but we can't raise chickens in the apartment. Well, could the landlord give us the freedom to do that? Yeah, but he doesn't. Then if we started to raise chickens, he would be upset. We can't raise chickens. So you see, it has to do with man. Freedom has to do with man. And these words get interchanged. But remember, a lot of people use them interchangeably. But remember the difference between liberty and freedom. Liberty comes from God. It's an inalienable gift, an inalienable right, and comes with our life. And then the pursuit of happiness is to get to heaven. So you see, if anybody violates your inalienable rights to life, liberty, or the pursuit of happiness, you should be upset. And if they violate it for someone else, we should be upset. And that's going on in our society to the people who are vulnerable. The person is alive, and we know what living is. Well, I'm a doctor, so we have medical science, and then medical science is not very good science, I just thought I'd tell you. But the basic sciences that it's based on are good. The biology is a good basic science, and it's good because you can study living things. Each person is unique, though. That's the reason you have all these things. It works for a certain number of people, but not for everybody, kind of thing. So we're not too good at medical science, but we do our best. But our basic sciences are good, biology, and then there's common sense. Common sense, but as Cardinal Rinze said in Louisville a couple of years ago, but in society, it's not very common to have common sense, that kind of thing. We're alive from true conception until true death. And the reason you have to say true conception is because the word conception has been distorted. But while it's distorted, it still means what it is. And you have to use conception. A lot of people use fertilization. Fertilization is what happens when you put together a bull and a cow. That's fertilization. You put together a rooster and a hen, that's fertilization. And you get baby chicks when you do that. Fertilization is not how you begin. You begin with conception. You see, because there's a difference between reproduction and procreation. And husband and wife get a baby because God creates the baby and God picks out the parents. And then between God and the new baby, they bring together the sperm and the egg for the formation of the body. And they don't use a whole sperm or the whole egg, just parts of it. Whatever parts are necessary. And that's between God and the baby. And they're already a male or a female. God creates them already a boy or a girl. And then they have to find the parts for their formation of their body. And they never change. You can't change them. God creates us. We're either male or female. You hear lots of stories about how us men have nicer lives than women, that kind of thing. But the women are like they are, and the men are like they are, and you can't change them. Sometimes, one of my grandchildren, 15 years old, said, she thinks that this transgender operations are okay. I said, well, wait a minute, no. What do you mean? Well, they're happier. Oh, I mean, and she goes to Catholic high school and has been in Catholic grade school. What are we doing? Anyway, life is in every cell, and the basic unit of biology is a cell. Cell has a nucleus, cytoplasm, and a cell membrane. And then cells come together to make up tissues. Cells and tissues make up organs. And yes, we do use systems and put them together. The systems have to do with functions. So there's 11 systems in the human body. There are 3 major systems: the circulatory system, the respiratory system, and the central nervous system, or if you want, focus on the brain because they don't want you to think about the spinal cord, but it's part of the nervous system. But 3 major systems, and then learn the word interdependence. Interdependence of cells, tissues, organs, and systems that maintains the unity of the body, which is the unity of the body and the soul. So remember, interdependence. They have distorted thoughts by using the word integration. And then it's a good word, integration is a good word, but they make the brain to be the central integrator. And if you don't have a functioning brain, then you're dead. That's all lies. But what happens in all of this, you have to understand the truth, you have to learn the words, you have to work at it and separate out the lies. And then once you get down to the truth is easy. Truth is easy. You know, each one of us is a living person and we're not dead. And even if we were unconscious and not responding, Jahai's not responding. We got Aiden in Nevada, which is her case is at the Supreme Court. 20-year-old college girl gets abdominal pain on the 1st of April, gets the operation, they don't find anything, but she doesn't wake up. 15th of April, they say she's brain dead. We're here almost the 15th of November, 14th of November, 7 months later, I think it's 7. She's very much alive. I saw her last week in Reno, Nevada. Her case is at the Supreme Court. The Supreme Court listened to a lawyer for 15 minutes, listened to a lawyer from the other side for 15 minutes, and there's 7 of them, and they're going to pontificate whether she's alive or dead. Come on. You know, I say to the lawyer for our side, I say, have you gone to see Aiden? No. Why not? I don't want to be emotionally tied. I just want to talk about the law. Come on. She's a 20-year-old college student who got bellyache and got an operation and things didn't go as good as they wanted to. She's not dead. She's not dead. Who would want to keep her? Who would want to keep a dead body? You know, Jahai's mom, they ridicule her mom for what she's doing, like she's doing it for money. Come on. She didn't do it for money. She's on the TV pleading for somebody to come and help her. So we help her, and Jahai's still alive, Aiden's alive. Maylene is in Brooklyn, New York, a 12-year-old girl who in the middle of February was declared brain dead. She's at home, she's very much alive. Why? Because somebody loves her. You know, why is Jahai alive? Why is Aiden alive? Why is Maylene alive? Because God says yes, and they have somebody who loves them, and that gives us who have a chance to help, and then we can go help. But I can't do anything unless God says yes, unless the parents say yes. So life, interdependence of organs to preserve the unity of the body, which is the unity of the body and the soul, and there's no one organ that's in charge of all the other organs. I have to pay attention to the time now, just a minute. Okay, we're still okay. Life on earth is a continuum from true conception. It has its ups and downs, and eventually life on earth ends, and true death is the word used. You see, before that, it's a living body, and for the living body to become a dead body, it must go through true death. No other way. The living body, it's a living body, so there's true death, and there's a dead body. Is Jahai a dead body? No, she's a living person. Is Aiden a dead body? No, she's a living person. They're not doing like we would like. They have serious problems, but they're not dead. To live on earth, you have to have blood and circulation. In the mystical city of God, where God and the Blessed Virgin talks to Venerable Sister Agrita, and it says in there that preservation follows creation. Preservation, see that key word, preserve, preservation follows creation, and then respiration, and I'll put it in water and nutrition. They use respiration and nutrition, but water. So you see, once you have creation, you have to have preservation, and then for preservation, you have to have respiration, which is oxygen, and you have to have water and nutrition. And it has to be uninterrupted. Uninterrupted. It's continuous. Now, the body has some ways when oxygen decreases to switch from what we call aerobic oxygenation to anaerobic. And anaerobic, that's without oxygen. It's not near as good, but it preserves and that kind of thing. So you have to have blood, and you have to have circulation. You have to have breathing, oxygen in, carbon dioxide out. You have to have water and food and the proper temperature for the body and the environment. And Aiden has normal body temperature. Jai has normal body temperature. Why is that? Because their brain works, because they're alive. So the dead body doesn't keep the temperature. The dead body equilibrates with the room and that kind of thing. But they have normal temperature. You have to have an exit for urine, for stool. Aiden and Jai and Maylene, they put out urine, they have bowel movements. Cadavers don't do these things. The breathing, the brain sends signals to the muscles to pull the air in. Ventilation is this movement of air. We inhale air with oxygen, and then we exhale carbon dioxide. But the way our body works is our muscles contract to make our chest get bigger, and air goes in. And then what happens? The muscles relax. And then when the muscles relax, the elastic properties of the chest and the lungs pushes our air out. And God makes our living lungs and living chest to have things like elastic properties. It isn't just human beings who have elastic properties. Rubber bands have elastic properties. The rubber band's laying there on the table, is not doing anything. And we stretch it, and we know when we let it go, it'll bounce back. How does it bounce back? Because it has stored energy. That's the way it is when we breathe. So we take a breath in, and then the stored energy pushes it out. That's how it works with the ventilator too. When somebody's on a ventilator, it's the living tissue that is expanded, and so the chest expands, and then the ventilator turns off, doesn't push anything in, and then it's the living tissue that pushes the air out. And the ventilator only works when somebody's alive. Ventilator won't do anything on a corpse or cadaver because the elastic tissues lose their elasticity. Destroyed tissues lose their elasticity. So ventilator is a machine that moves air into the trachea and the lungs, and it does result in respiration, but that's the exchange of oxygen and carbon dioxide which takes place in the tissues of the lungs, but then via the circulation in the tissues of the lungs and then the rest of the body. So you have to have circulation, you have to be alive for the ventilator to work. Circulation, the heart's a fascinating organ because the heart has its own nervous system. It causes every heart muscle to contract, and then it makes it stop. And all of that's built into the heart. You don't need the brain for the heart to beat. The beating of the heart is intrinsic to the heart. The brain is not necessary. So in life, there's an interdependence of organs and system. There's a mutually interacting of the liver, the kidneys, the heart, the lungs, the thyroid, the adrenals, the intestine, the bone, and the skin, and calcium metabolism. And then you might hear this term if you've ever been in heart failure or somebody, the cardiac natriuretic factor. It affects the renal secretion of renin, which regulates the blood pressure. So you see, the brain doesn't have anything to do with that. It has to do with the heart and the interaction with the kidneys that maintains our blood pressure. The brain does have something to do with blood pressure because it keeps the tone on the blood vessels. Energy balance, maintains healing, fight infection. Jahai does this, Aiden does this, Maylene does this. They all do these things, but yet they're called brain dead. Jahai even has a death certificate. Without circulation and respiration, we're dead quickly without treatment. Without oxygen, we're dead in minutes, and our tissues become destroyed. Our organs get destroyed. Without water, we're dead in 1 to 2 weeks. Terry Schiavo took 13 days. Why did it take 13 days? Because you're not very active. Without water, it'd take maybe 5 days for us. Yes, because we're more active, so our metabolism is different. Without food, dead in 1 to 2 months. After World War II, the people who were in concentration camps, who were starved, they always carried some food with them because how awful it was to be starved. It takes 1 to 2 months to die without food, 1 to 2 weeks without water, minutes without oxygen. Dead is the absence of life, and in the Greek, the bios has to do with life. Pathos has to do with death. It's disease, it's destruction, pathological, so it's different. Life and death are different. A cadaver is a corpse, it's a body without life. Without life, the soul is gone. And so you have the remains of someone. It's not a dead person, it's the dead remains of someone, not a dead person. See, the person is in life. And so it's a remains. Yesterday on the way up there, I had a good conversation with 2 nice ladies in the back seat, and I was in the front trying to listen. My hearing's not so good. Good conversation brought out lots of these things, but in order to have a conversation, you have to realize what the words mean. If you talk about a person that's alive, it's not a dead person. You know, if you have a dead body, that's the remains of someone. Anyway, we don't discipline ourselves in these matters, but you have to, because the other side has distorted the words. They have a language of death. We must have a language of life, and then we must stick to it. It's easy to stick to the life. After death, there's dissolution, destruction, disintegration. We can slow it down by cooling or embalming. After true death, what remains on the earth is a dead body, a corpse, a cadaver. The cadaver's not breathing, there's no heartbeat, there's no pulse, there's no blood pressure, there's no circulation, it doesn't respond, it gets cold, the color's poor, rigor mortis, but rigor mortis is something that happens in the muscles hours after the circulation has stopped. And it doesn't happen immediately. The body doesn't get stiff. It's pretty limber after death. And then hours later, rigor mortis. That's a true sign of death. Do you have to wait for rigor mortis before you declare death? No, you don't have to. Rigor mortis is a true sign of death. So there are true signs of death. You see, we can know what life is. We can know what death is. We might have difficulty with knowing the instant of death, but if we don't know the instant of death, we should presume and assume that the person is alive. And what do you do for when somebody's alive? You pray, if nothing else, and you give sacraments. And if there's any question about life, you can still give the sacraments. But it won't do any good to give the sacrament once rigor mortis is set in, because the dead body doesn't get sacraments. Sacraments has to do with life. And so you can no doubt, but maybe the instant might be difficult to identify. I'm going to tell you, the next is a TV recording of Zach Dunlap, who's a young man, 20 years old, injured on a four-wheeler, and then declared brain dead. And he happened to have a relative who was a nurse who did another test, got a response, and then everything stopped.
Headed back to a hospital 50 miles away, Zach's prognosis couldn't have been worse.
His brain injuries were absolutely catastrophic.
With Zach unresponsive to any sensory stimulation, the hospital's director of trauma services ordered a comprehensive brain scan study. He showed Zach's parents what he saw.
He told us the dark areas will be the areas where there's no blood flow to the brain.
And that was the whole brain. That was the whole thing. It was just black.
Were the doctors giving you any sense of hope?
They'd already said he was brain dead.
Pam and Doug were told they could expect the harvesting of Zach's organs to get underway within the next 12 to 24 hours. With the clock winding down, the hospital notified authorities that Zach had died at 11:10 that morning, 36 hours after the accident. As a helicopter sent by the organ donation team was scheduled to land, friends and relatives gathered to say their goodbyes. That's when everything changed. Divine intervention, said his family, set in motion by Dan and Christy Coffin, Zach's cousins, who were also both nurses.
I started getting this different feeling in my gut, and I thought, he's not ready.
Dan wondered the same thing as he looked at the monitor to study Zach's vital signs.
Things were just looking better to me.
What did you do?
I grabbed his foot, I pulled my pocket knife out, and I scraped from his heel up to his toes.
Dan and Christy said they got the shock of their lives.
He jerked his foot from my hand.
Was it possible? Was Zach still alive? Needing to challenge even his own skepticism, Dan said,
Let's try this. So I grabbed Zach's hand, and I stuck my fingernail underneath his fingernail. You know, that's a tender area. And Zach just threw his hand over here. And by now, this
So
guy...
he physically moved that arm over his body.
Across his body.
And I kind of drew up inside myself, you know, and I'm like, oh my God.
I can indeed verify that these were purposeful movements.
purposeful movement rather than a reflex twitch is a telltale sign of brain activity. Suddenly, 4 hours after Zach was declared brain dead, his room was bustling. Pam and Doug were out in the hall getting ready to head back in to spend their final hours with their son when they were stopped.
And the lady that we've been talking to from the organ liaison came in and sat down with us, and she said, everything has stopped.
And everything stopped. What stopped was the taking of his organs.
Yes.
He had the technecium scan, which is the same scan they used on Jahan. But you got to know that all of these tests that are done, like scans, are tests. Every test is ever done has to have a stimulus, and then there has to be something sensitive enough to pick it up. And just because it doesn't pick up anything doesn't mean it's not there. It means that the stimulus is not sensitive enough. And they keep coming up with more and more studies to get more sensitive. That's because the others fail. The technecium is supposed to be the gold standard, as they called it. But you see, it failed so far as Zach is concerned. It's failed so far as John is concerned, and that kind of thing. Now, I'll just show you a little bit more that had to do with the, and then there's Zach, and then of course he's fishing. And now, one more thing, and then we'll take a break. But this is from a book on transplantation, and I purchased the book, and in there had a CD. And the CD has to do with organ transplantation. And so the section of this book is called multi-organ, that's more than one organ, and that's procurement. You might call it harvesting from a deceased donor. Now, deceased is a word, you can look it up in a dictionary. It comes from the Latin word decessus, which means departure from life. It means death, so deceased means death. And then you'll see it's a operation, they open the chest and the pericardium. Pericardium is it's a covering around the heart. The tissues around the heart is called the pericardium. And then it opens up, and behind that, as they open it up, you will see the beating heart. This is somebody who's brain dead. Brain dead, and this is the procedure to take the organs. And this is how it starts. When they take the organs, they make the incision from the sternum, from the neck, down to the pubis. And that's how it starts. And you'll see the beginning of it, and then you'll see the beating heart.
An incision starting from the sternal notch to the pubis is made. The sternum is divided.
See, pink tissue.
And the thoracic organs are exposed. The self-retaining retractor can be used, and the pericardium is divided to expose the heart and the pericardial cavity.
Wow. See the
The
beating
falciform
heart.
ligament is divided.
Wow. So you see the beating heart. Now I can tell you that I have taken this to Rome and showed it to Cardinal Burke, so there's no doubt that he's seen it. I've taken it to Australia and I've shown it to Cardinal Pell. There's no doubt that he's seen it. They know. And so it isn't that they don't know. When they see it, they get, like maybe most of you, amazed, that kind of thing, hard to believe, whatever it is, but at least you now know that it's a beating heart every time that they get these organs. Well, I have to stop now, and we'll take whatever number of break that you
Would
have.
you-
How much time do we have?